Singapore enjoys one of the highest kidney transplantation success rates in the world. But 40 years ago, prospects were grim. If you had a kidney transplant here, you stood a 1 in 2 chance of dying from organ rejection.
This is across the country, by the way. Right?
This woman helped to change that. For her entire career, Prof. Vathsala has been driven by a singular purpose: to add years to the lives of kidney transplant patients. And it's a fact I'm grateful for after I recently learned that a friend had been diagnosed with renal failure. I'm curious to find out more about the part Prof. Vathsala played in bringing hope to renal patients like my friend, and why the good doctor is such a passionate, even brash advocate.
Hi, Joe. Come on
Vathsala.
in. Come on in.
Thank you so much for having me.
Come on in.
Thank you so much for letting me into your lovely home, Prof.
Oh, thank you, Joe.
I don't know how you find so much time to do so many different things, be a grandmother, be a doctor, be a professor. Your life philosophy is to add life to people's years and years to people's lives.
I think what I'm known for is my patient advocacy. And if what I'm doing is the right thing for patients, I think I'm respected for it, I would say, even though I'm sari-clad, a bit more brazen, a bit more bold.
You didn't start your life in Singapore, so tell me about that.
I was born in Mysore, India, and my father was professor of engineering at Auburn University, Auburn, Alabama. So at the age of 11, I went to the States together with my mom to join him there. I lived the next 12 years of my life in the United States. I'm afraid I was a bit of a nerd and a geek. Yeah, I was a bit of a bookworm. And because I was younger than my cohort, I didn't quite fit in my early years.
What brought you to our shores?
Okay, of course, Ananta brought me to Singapore.
Your husband?
Yes, right. I met my husband while I was still in medical school. I had family here in Singapore. So on one of my summer vacations, I was here and my family introduced me to this very handsome doctor. You know, so
On the record.
eligible, right? So that's how we met. A lot of who I am today is influenced by him. He opted not to go to the States because he was a captain in the Singapore Army. He had done his medicine in Singapore. So he says, no, I'm not leaving Singapore. So Singapore is it for me. It's a decision that I've never regretted.
During those first few years, I heard that it was difficult for you in Singapore. Why was that so?
My university, Vanderbilt University, had not been recognized as approved university for allowing people to practice. So my husband actually wrote in hundreds of letters, I think.
How many years of appeals?
It was like a year and a half of appeals. We have a whole stack of letters that we've kept because I think they were very sweet.
I love that his love letters to you were actually love letters to different hospitals across Singapore.
To mainly the Ministry of Health. And finally, around December of the year that we married, I was allowed to work. But they said I had to work in the toughest unit in Singapore. Medical Unit 3 was one of the 3 units that ran the medical department in Singapore General Hospital. It was run by Prof. Sia Cheng Siang. And if I survived Prof. Sia, they would consider giving me an opportunity to work in Singapore. I had to learn the language. Disease cannot be managed without being able to talk to people. So the multilingualism that I acquired certainly helped me to adapt to Singapore. So I learned my Hokkien, I learned my Malay, a smattering of Cantonese, so I can do a pretty mean conversation for patients with my Hokkien. Yeah.
你會曉講福建話無？
不能啦，會傳噃。你會使講福建咩？
I think your Hokkien is better than mine, so I'm going to stop now.
I think so.
So after those few pretty tough years, you were offered positions with gastroenterology, with cardiology, and also with nephrology. So why did you choose the kidneys over the heart?
I really wanted to do cardiology because I was really good at it. I was an accidental nephrologist in the sense that I was posted to nephrology and my head of unit, who was Dr. Lim Cheng Hong, he's the founder of nephrology in Singapore. He just said, Vathsala, you're just going to be retained. I'm not going to release you to cardiology. So I think in life, you see one door open, you look for opportunities. And really, I love transplant. The minute I saw it, I said, yeah, this I really, really, really like.
I have to say, I haven't heard that very often before, that somebody loves transplants. How did you find out that that was the case with you?
In the 80s, dialysis wasn't offered for everyone. It's difficult to think of Singapore 40 years ago, how it was, but people used to die without dialysis because there were no dialysis facilities. I have to admit, I would sneak in some dialysis here and there for patients when nobody knew. But that's not the way to really go to saving lives,
It's
right?
not the long-term solution.
But transplant is life transforming, honestly, you know. You put in a transplant, a kidney from someone else, and then that person is set for life, you know, and they can lead wonderful lives.
Yes.
I have my transplant patients who do Olympics and they win medals. How meaningful is that? And so that's why I became very passionate about transplant.
It was quite a different scene from the way it is today. People were still rejecting these kidney transplants.
I find myself extremely fortunate having joined transplant at that time. That was just the dawn of the renaissance in transplantation. The incidence of rejection was like 50 to 60%.
So more than 1 in 2 people would reject their kidney transplants.
Yeah, correct. But then right at that time, there was the new drugs that were coming on. Those initial drugs brought it down to about 20 to 30%.
Why do transplant patients require immunosuppressant drugs?
A transplant organ is a foreign organ. It's like an invader, right? So the minute you take an organ from someone else and put it into this patient, the immune system, they'll go and attack it. The only way to stop this rejection process is if you suppress these killer cells. And that's why we need immunosuppressant drugs.
When you noticed the rejection rates after the subsidy of these drugs had been completed, you actually spoke to some fellow stakeholders about it.
Because Singapore was so cautious and it was an expensive drug. When Ministry of Health approved it, they approved it for a year. But then the minute we stopped, we would have rejection come back in. I had learned from my experience that once you get rejection, the kidney transplant could fail over the next few years. So I had a conversation with someone. I said that this drug, that if we stop it, you know, at the end of a few months, the patients would get a rejection and then lose the kidney. And it was that person who released it to the Straits Times. I don't want to mention names. And the Straits Times picked it up, and then the ministry wrote in and asked, why did this happen, that this drug is being withdrawn and we are going to lose kidneys because of that? My son did his
I'm spending the day with Professor Vathsala, a doctor who in the late 80s helped improve the survival rates of kidney transplant patients in Singapore.
My interest was to ensure that patients kept their kidneys for a lifetime. So finding a source of funding for the drugs was important. So this is why I was engaged in various conversations. It was evident that this drug was producing fantastic success rates in the United States. If you know something is good, why wouldn't you want to bring the best to Singapore? We were very happy to present the evidence because the evidence was really very clear. And it is true that right now Singapore's success rates are among the best in the world.
So my understanding is that because we have these potent immunosuppressant drugs to lower the rejection rate of foreign kidneys, there can be different types of kidney transplants even though they're not genetically similar kidneys to the patients.
Absolutely.
Wow.
You got it.
I'm a nephrologist.
Yes.
Accidentally.
Yes.
So now you work at the National University Centre for Organ Transplantation, where you take care of different transplantation patients. NUCOT, what is called for short.
I'll take you to NUCOT and you'll see what a great transplant center and clinic we have. Shall we get to work?
Oh, yes, please.
Professor Vathsala is, today, the co-director of the National University Centre of Organ Transplantation, or NUCOT, where she continues to uphold the standards she has set.
So this is where I spend my day. And my heart's in here, my life is in here, my passion is in here.
Wonderful. That's
Yes,
wonderful to
yeah.
hear. But your kidneys are with you.
My kidneys are with me, but one day I hope it will go to somebody who needs them.
Oh, wow. Walking the talk.
Yes.
So, Professor, what do you think sets NUCOT apart from other transplantation facilities?
We are everything for our patients. I mean, we are sometimes a primary care provider and the tertiary and the quaternary care provider, meaning from the beginning of their journey before transplantation till throughout their life journey. We're there for them for everything. Planning their transplant, deciding which immunosuppression or which medication they need to receive, how much to give, when to stop, when to reduce, everything. We take care of their kidney, we take care of their heart, their cancer risk, their infection, their immunosuppression, their bones, you name it, we are
All
there.
of that.
Yeah, right.
Right.
Yeah.
So if after the transplant they fall ill and they can come to you for advice and prescriptions as
Yeah,
well.
they can call our coordinators anytime, you know. I sometimes say, it's like Ghostbusters, who are you going to call? You know, it's like that. Oh,
Hello.
Hey, hi.
Prof.
This is Prof. Tiong.
Hi.
Okay, and
Hello, hi.
he's my buddy.
Oh, lovely.
Pleased to meet you.
Is it okay if I chat with him about you a little bit?
Sure.
I
Don't say anything nasty.
I'll say only good things.
See you later.
Thank you.
Bye.
Bye.
Thanks,
See you later,
Prof.
Prof.
How and when did you get to know Prof. Vathsala?
I've known her now for almost 20 years.
Oh.
I was finishing off my surgical trainingship here in NUH. I wanted to pursue kidney transplantation as a fellowship in America. And I know Prof. Vathsala is a pioneer of kidney transplant in Singapore and very medically renowned. So I emailed her, to see whether I can come and learn from her. And she kindly said yes.
Was she the type of mentor you expected her to be?
I did not feel that she's an ivory tower kind of professor. She had to build kidney transplantation from the ground up. And that means that she has to be on the floor, looking after patients, day-to-day management. I think that is very important because you're not just a theoretical professor, you are a practical professor.
Do you feel there is one anecdote that really condenses who she is?
I remember when Prof. Vathsala and I went to a meeting consulting Ministry of Health and other specialists on how to expand kidney transplantation to other people. After the meeting, I asked her, do you think that you were a bit harsh on them and being very pushy on what can be done? She said, I am an advocate for kidney transplantation, an advocate for my patients. If there is no one driving it passionately, then things will not happen.
In addition to her role as co-director of NUCOT, she is also the head of medicine at the National University Hospital and the Yong Lu Ling School of Medicine at the National University of Singapore. But she has never stopped being a physician.
Hey, hi, Aaron. How are you?
Just ask Aaron Tay. At the age of 8, he was diagnosed with lupus, which caused his kidneys to fail. He later became a long-time patient of Prof. Vathsala.
She has essentially been taking care of you for how many years now?
Well, I was 14 that time and now I'm 44.
Okay.
So about 30 years.
Wow. I understand at one point in your life, she suggested that you might want to stop your kidney medication.
That's right.
Even though there was a risk of kidney failure. What happened there?
I was 23 years old. So the doctors found a tumor in my left nose. And to remove it, he cut off my face,
Wow.
removed the skull. So there was two options for me: to stop my medications and hope that the lump will subside, or to carry on my medication to run the risk of cancer. But if I stop the medication, I will run into kidney failure.
I see.
So at the end of the day, I decided to stop the medication and I had to undergo dialysis for 4 years. And after 4 years, my heart started to give way and I had to go for an emergency kidney transplant in order to save my life.
Of course, the transplant was successful.
Yes, yeah, that's right. Yeah.
And I understand that the professor was involved in some aspects of your family planning as well.
So at that time, after getting married, wanted children. So a trip to the sperm doctor revealed that I had 0 sperms because of the long-term medications and chemotherapy also for my lupus. But I recalled that Prof. Vathsala advised me 12 years ago when I was 21 to store my sperms before I go for the chemotherapy. I did IVF, and now I have 3 daughters.
Can I take a look at them?
Yeah, sure.
Oh, they're beautiful!
That's right.
Do these girls know that they only exist because of Prof. Vathsala? I'm spending the day at NUH to understand what makes Prof. Vathsala such a passionate advocate for kidney transplant patients. Hi, Dr. Lee. I meet up with Dr. Grace Lee, an old comrade in arms of Prof. Vathsala.
Thank you. Have you had a busy day?
Yes, very. When I joined the Department of Renal Medicine as registrar,
Okay.
Vathsala was there already, in fact. And shortly after, we were joined by my friend, which we formed what we called the Charlie's Angels.
Oh.
Yeah, really. The 3 of us.
Right. Were you
Yeah.
the only 3 women?
Yes,
in the
we were
department?
actually the only 3 women registrars at that point in time. And I think we ruled the world.
How was it back then, and how do you feel that it has evolved since?
Well, back then, I think a lot of the resources were limited. Patients were denied dialysis, could not find transplants. And it was tough on us as young doctors to realize that, you know, some patients just will not be able to get the treatment that they would actually require.
Did you think that it was because of that motivated Prof to actually fight for more types of immunosuppressants to be subsidized here so that there could be different types of transplants that were done to benefit patients?
Yes, definitely. It goes a long way to reassure patients, because otherwise a lot of patients may actually have thought, if I have been transplanted, I may not be able to afford the medications. I see that she has really made her mark in forwarding and in advancing the transplant program, and it's quite amazing. She's really driven. At a time when we are all trying to step down, she's still stepping up. So I did ask her, I said, what are you doing? Why are you still taking on more and more of the stuff? And I think that probably shows how passionate she is and how much more she feels that she can contribute.
Following an afternoon spent at her workplace, Prof. Vathsala and I head back to her home, where I meet her husband, Professor Ananta.
Hi, Anda.
Oh, hello.
Okay, so this is Joe. Hi, this is my husband.
Hi, Prof. Ananta. Nice to meet you. I've heard so much about you.
Nice to meet you.
Okay, so I'm going to go and change. I'll be back in a while.
Okay.
Okay.
I'll have a chat with you, Prof. Ananta. Okay, wonderful. You're the person who's closest to Prof. Vathsala, and you're the person who's responsible for her coming to Singapore. So if you wanted to sum her up in a nutshell, how would you describe her personality, her work ethos?
Before that, have I told you that I'm the first member of her fan club?
You have. You've actually told me about that. Would you say that Prof. Vathsala is more American or more Asian today?
She is typically an Asian, but she has learned some very good American values. She's prepared to speak up, and we associate that with a Western approach, which is a good thing.
And of course, she's a trailblazer in a lot of ways.
She was the first lady to be president of the Asian Society for Transplantation. Secondly, she is the first lady to be the head of the Department of Medicine at the National University of Singapore. And those two are really no small accomplishments for a lady, especially one who is a regular sari-wearing lady.
And she's the first lady of your heart. The medals over there?
Yeah,
Oh,
they're kind of displayed here.
okay.
My favorites are here. These are
okay.
from my transplant patients. Thank you for taking care and walking this journey with me for these last 20 years. I couldn't have gone.
Looking back at your early years in India and growing up in the United States, what aspects of those did you bring to Singapore?
I think I was a bit more American. I was a bit of a bull in a china shop. I did not hesitate from what I thought was the right thing, and
Yeah.
learning to be self-contained and being confident in a foreign environment was something I had to learn. So I learned very early to embrace my difference rather than try to be like everybody else.
So, would you say that it took you a while to integrate into Singapore?
I did. I mean, I think it required cultural adaptation.
How so?
Being a bit more timid initially was important.
Or rather to present yourself as a bit more timid?
Yes, I think so. Yeah, it's often unsuspecting, you know. The timidness is a bit of a guile.
Okay.
And then the precision comes out. The Americanisms come out. Yes.
Right.
Yes.
What are your thoughts when you look back at this life journey of yours?
The journey has been wonderful. I wouldn't turn the clock back or change it in any way. What cannot be unsaid is that I've been supported wherever I've been. I've been supported in my career, by my family, but I've also been supported by all my colleagues at work. Many of the things I have done is because I've had support from hospitals and the government, you know. This doesn't happen without a meritocratic system that allows people to be recognized for the work they do and to people to be listened to. I'm actually a nobody. I mean, I have no blue blood in me, but I still had people listen and I still got the opportunity to change things.
Having spent the day with Professor Vathsala, I can't help but feel grateful that she made Singapore her home 40 years ago and dedicated her life to making it better.